How's everybody doing today? I'm great, thank you. My name is John Waller. I'll be doing the presentation today, and I have some helpers in the back. We have Tyler and Tucker back there, and our audio video crews here because we're using this as a training thing. So everyone say hi to Sarah. Hey, hi Kenzie, hey. So first things first, there is this piece of paper on the table. If everyone could please fill this out. I need this to turn in to show that I did not buy dinner for 18 of my closest friends. But at the end of this, we're all going to be friends, right? Okay, and then also on the table is the menus. If you would like to circle what you would like to eat, they're going to come collect all the menus momentarily. Now, the way tonight is going to work, I will go ahead and start the presentation to be respectful of your time. When dinner arrives, I will pause and give you all about 10 minutes to get settled, ask for any additional sauces you may or may not need. Once everybody gets working, I will continue the presentation to be respectful of your time. And that way we don't hold you hostage here for too long. Okay? Thank you much. Thank you, sir. Has everybody made their menu selections yet? Hey, come on in. Come on in, sit wherever you like. Okay, folks, we're going to go ahead and get started. So on the table is all the information that you're going to need in this folder right here. So inside the folder, we have several things. We have our book that breaks it down, what we call Barney style, kind of breaks down Medicare a little bit, very easy to understand. Behind it, this stapled piece of paper, this is the exact presentation I will be doing on the screen. So that way, if you have your back to the screen, you don't have to hurt your neck turning around. You can just flip the pages, and I will let you know when I move to the next page. But this is the exact presentation we'll be talking about, and there's also a little bit more information in here. So we're going to go ahead and get started. Okay, folks, so I'm assuming everyone here, are you new to Medicare? Raise your hand if you're new to Medicare or about to be new to Medicare. Okay, good deal. Well, you're in the right spot. So today, we are here to help you make the right choice with information. Today, we are going to cover the basics of Medicare. We're going to talk about Medicare supplements. We're going to talk about Medicare Advantage plans. We'll talk about prescription drug plans and important dates and more. The point of this seminar, I am not going to get too granular with this because everybody's healthcare is very individualized. I'm going to give you a 3,000-foot elevated view of Medicare about how the gist of things, and then we can get into the nuts and bolts in a little bit. Now, raise your hand if you've seen commercials about Medicare. You're already getting phone calls, you're getting the mail, and you're inundated with everything. Okay, now Medicare, it is very confusing if you haven't noticed. It's kind of like looking at a duck-billed platypus for the very first time. It's kind of like, what is this? Okay, so Medicare is kind of a little bit similar. Now, the cost of health care in retirement is extremely concerning. We're all hyper-fixated on it. The estimate by 2028 will be about $6.2 trillion spent on health care. This is a little bit of a dated chart, but it just shows you how insurance premiums have been steadily rising over the past several years. So much so that percent of annual spending, what we are finding is that seniors spend a lot more on their health care to the tune of about 13%. Well, so let's break it down. What is Medicare? Medicare is broken down into three parts. You have parts A and B, which is called traditional Medicare. That's that red, white, and blue card, okay? That's parts A and B. There's another part of Medicare called Part C, and that is the Medicare Advantage. You see a lot of television commercials about those particular plans. And then there's something called Part D. That's the one letter that does make sense. It stands for drugs. That's your drug coverage, Part D. Now, on traditional Medicare, Medicare A and B, Medicare A is going to cover your hospital, skilled nursing facilities, hospice, and home health. That's where Medicare A kicks in. Medicare Part B is everything else. It's going to be your doctors, outpatient care, occupational and physical therapies. Medicare Part C, that Medicare Advantage, that is going to cover everything that Medicare A and B cover, and then you get additional benefits, for instance, like dental, vision, or hearing. And then Part D, that one thing only covers prescription drugs. That's for a standalone drug plan. So, Medicare. Who is eligible for Medicare? At the age of 65, you are eligible for Medicare, even if you are still working. That is when you are eligible to enroll. You may be eligible earlier through a spouse, although they need to qualify by age, or if you have a certain disability, you can get on Medicare before 65. You may also qualify before 65 if you have a disability. Now, this is the card that I was referring to. We refer to this card as the red, white, and blue card. This is traditional Medicare. This is Medicare A and Medicare B. Remember, Medicare A covers your hospital, things like that. Part B is going to cover your doctor visits. Now, there is an automatic enrollment. If you turn 65, you retire, and you start to draw your Social Security benefits. Then you will automatically be enrolled in Medicare A and B when you start drawing your benefits. Now, you do not need to draw your benefits unless you choose to. If you choose, you can still join Medicare and defer your Social Security benefits till 67 if you choose. There's a way to do that. So don't feel like you have to draw in order to join Medicare. There's lots of people, it's called deferring your benefits until later to get maximum. So just know you can join this even without joining your benefits. Now, the initial enrollment package will be mailed out to you 3 months before your birth month, okay? Some of you may have already received one, but they will send that out to you. It's an information about Medicare. You're about to be approaching 65. This is just one piece of the thousands of pieces of mail that you guys are probably receiving. Okay, so the initial enrollment period, this is when you're brand new to Medicare. Medicare gives you a window to make your selections. You can make a selection 3 months before your birth month, up to 3 months after your birth month. So you have a 7-month window to make your selections, which is fantastic because your health care should not be made haphazardly. You should really look into it and decide what is best for you. On Medicare, there is no such thing as a best plan because everybody's unique combination is unique to them. Just because Mrs. Jones takes this number of drugs, Mr. Jones might have something totally different. Medicare is very individualized, so it really goes down to you. So the initial enrollment period, 3 months before your birth month, so let's say if you were born in June, you can enroll in Medicare. To start in June, you could actually select your plan as soon as March, okay? And if you do not make your selection, you have up to 3 months after your birth month. So you still have June, July, August, and September. September will be the last one. So you have a nice little window to make your selections. If you retire after 65, okay, what if I don't want to retire at 65? What if I want to retire at 67? No worries. Your enrollment depends on when your employer-sponsored coverage ends. So if you're working and you have employer coverage, you can defer your Medicare as long as you're working. What the government is interested in is, do you have credible coverage? As long as you are enrolled in health coverage, you can delay Medicare with 0 penalties. Now, on the flip side, if you don't have coverage, if you have no insurance, you just need to go ahead and get on Medicare because they will penalize you the longer you go without insurance, okay?
Is there a time limit on that?
On the penalty?
No, if you're working.
Oh, no, there is no time limit. For example, if you're still working, let's say you want to work till 70, and you have employer coverage,
Right.
that is considered credible. You will not enroll in Medicare Part B, because you'll find out in a minute. You will defer it. At 70, that is when you enroll yourself into Medicare Part B, and you will have no penalties, as long as you had credible drug coverage. Okay? We're going to get into a little bit more in depth in a minute. Okay, with original Medicare, raise your, I love asking this question. Raise your hand if you think Medicare is free. This is the first seminar I've ever done that I did not see a raised hand. At one time, right? I've met so many people that was like, well, I pay taxes my whole life. I'm going to get Medicare. There's no cost in Medicare. That is not true. There is cost in Medicare. So, for example, with the red, white, and blue card, traditional Medicare, Remember, Part A is covering hospitals. Medicare Part A doesn't have a monthly premium. It does not, as long as you worked for 40 quarters and paid taxes in your life. So 10 years. As long as you worked for 10 years and paid taxes, it does not have to be consecutive, could be on and off, but as long as you pay taxes for 40 quarters, Medicare Part A does not have a premium. If you did not work for 40 quarters, there is a premium, and it's actually quite expensive. Medicare, the premium is a little over $500 if you have not worked and paid taxes, because Medicare is funded through taxpayer dollars. Medicare Part A does carry a deductible, and this is where the expensive part comes in. So if you only have traditional Medicare, your Part A deductible is $1,676 per benefit period. What does that mean? If you go to the hospital and you're hospitalized for a night, you have a $1,676 deductible. When you get out of the hospital, you've met your deductible, but this goes by benefit periods, and a benefit period is 2 months. So if you went into the hospital in January and then went back into the hospital towards the end of the year, you would pay that $1,676 twice, because it resets every 2 months. Now, hospital copays. After you pay the deductible, the first 60 days, you don't pay any copays. If you're in the hospital beyond that, it does get quite pricey. Day 61 to 90 is $419 a day. Then it jumps to $836 a day. If you're in the hospital over 150 days, it covers 100%. Skilled nursing. Skilled nursing facilities is a facility that you go to recover after a major surgery. You need to have nursing care. It's not a nursing home. You're only there as a visitor to get well, and then you're going to check out. Skilled nursing, days 1 through 20, it covers it very well. Starting on day 21, it jumps to $209 a day each day for the skilled nursing. After a day's 100, there is no more coverage. If you're still in skilled nursing, you will pay 100%. So that is Medicare Part A. Medicare Part B is going to be your doctors. This one does carry a monthly premium. Medicare Part B in 2025, the monthly premium is $185 a month. Now, they take this premium, most people set it up for Social Security deduction. So once you're enrolled, they will go ahead and withhold that premium before you receive your benefits. Okay? Now, it starts at $185. If you are a high income earner above $220,000 a year, they adjust it based on your income. But if you're under $220,000, it's $185. And it can go all the way to $628,000. That would be for people making multi-millions a year. Okay. Now, on Medicare Part B, it does carry a deductible. The deductible is $257 a year for a calendar year from January to December. Okay, and that resets once a year. That's the deductible for Part B. When you have Medicare A and B, Medicare is going to pay 80% of your bills. You are responsible for 20% on traditional Medicare. Now, we're going to go over, after reaching the Part B deductible of $257 a year. So once you hit your deductible, you are responsible for 20% of bills. Now, 20% of a sinus infection, that's no worries. Anyone can pay that. However, 20% of an open heart surgery, now we're talking potential bankruptable numbers. With traditional Medicare, it only pays 80%. You will be responsible for 20 full percent, which is why we're going to discuss today the two options you have to cover up this 20%. Okay, because the 20% is scary. Okay, so remember how I said if you were a high income earner? This is a chart. It's in your packet. We're not going to go get too much into this. Okay, so your Medicare options. What you can do, you can select to do traditional Medicare, Medicare A and B. Everyone needs to have that in order to get one of these supplements. Whether it's an Advantage or a Medicare supplement, you have to have Medicare A and B. I consider it the ante. That's the pay to play. You have to have A and B in order to select other things. What your choices can be, you can stick with A and B and add a drug plan, because A and B does not come with drugs. Or you can do A and B and a Medicare supplement from a private company. with a drug plan. That will cover you. We're going to get into that in a second. Or the second option, you can go over here and go the Medicare Advantage route. I'm going to break down both of these in just a second to let you know what the biggest differences are. We're going to talk about Medicare supplements first. Okay, so how does a Medicare supplement cover the 20%? Okay, unlike original Medicare, a Medicare supplement is a private company that is managing these insurances. All Medicare supplements, they all have different letters, Plan G, Plan N, Plan F. If it's a Medicare supplement, they are all regulated by the federal government. Every Medicare supplement functions identical. By federal law, there's a federal law called MACRA. The differences in the supplements is the companies that sell them. I use an analogy, it's like buying a car. So if you are in love with your Toyota Camry, that exact car will be priced differently across the nation at all the different dealerships. Some dealerships have amazing service. Some are going to rip you off. Some give you great pricing, any combination, right? But that car is going to be priced differently. Medicare supplements are the exact same. It's the exact same product. Different companies sell it at different pricing. At Bobby Brock, we represent all the companies, and we are contracted with all of them. So what we try to do with Medicare supplements is to get you an A-rated company with the lowest price possible, because they are all federally regulated. It's the exact same product. So with this, these private companies, the government gives them money and says, manage this. Because they're privately managed, they function very, very well. Medicare supplement is going to cover the gaps on traditional Medicare. It's going to cover the coinsurance, the yearly deductibles, and the copayments. In your packet, there is a screen that looks just like this, a piece of paper. These are all the different Medicare supplement plans. We are going to focus on the two most popular. The two most popular is going to be the Plan F and the G, these two right here. Those are what we write the most of. These two plans help the most amount of people. So I've got it broken down on a screen right here. On this side, this is called a Medicare Supplement Plan G. This is called a Plan N. They both function very similar. The way these work, you will have a monthly premium for your Medicare supplement. The supplement is going to cover 100% of the Medicare Part A costs. That deductible of $1,632 every 60 days covers that 100%. Both plans do. The Medicare Part B coinsurance, the 20% that you would owe, these cover that. You don't have to pay the 20%. Covers blood for the first 3 pints. It'll cover the hospice care coinsurance. It will cover the skilled nursing facility. Remember those expensive charges? It covers all of that. It covers your Part A deductible. The only thing that you're responsible for is the Part B deductible. And that is $257 for a calendar year. When you're enrolled in a Plan G, you'll have your monthly premium. When you use a doctor, your deductible is $257. Once you reach that, no more bills. Your G covers all of it. So if you were to have an open heart surgery on a Medicare supplement, it will cost you $257 for your deductible. After that, it's going to cover everything else. Okay? These are the Cadillac plans of Medicare. Now, the Plan N covers everything the G does, with one exception. On a Plan N, there is something called excess charges. That is, a doctor is legally allowed to bill you 15% more than the agreed upon cost of Medicare. Now, on a Plan G, if that doctor charges that extra 15%, G covers it all. You don't pay anything. On a Plan N, you are responsible for the excess charges. Now, only 3% of doctors do excess charges, and in North Mississippi, 85% of them are dermatologists. Don't know why. So, just know they're rare. You do not see them very often. But it's important to know that if a doctor does charge excess charges and you're on an N, that will be your responsibility to pay it. They're usually small, but it's just important to know. The other difference between the G and the N, this one carries a much lower monthly premium, the N does, Because each time you go to a doctor, there is a $20 copay involved. That's it. That's it. It's a $20 copay. So if you go to a specialist, $20. If you go to your primary, $20. And again, your only deductible is $257 for the year. After that, it covers 100%. If you've met your deductible on a Plan N, you've already met the deductible, you will have no more bills unless you go to the doctor again, and you will only have copays each time you go. Other than that, no more bills. So this original Medicare, this is the very first slide I showed you, the difference between the A and the B. On a Medicare supplement, it's going to cover that. You do not pay the $1,676 a year when you're on a Medicare supplement. If you are in the hospital more than 60 days, you will not spend the $419 a day on a Medicare supplement. It covers all of that. It covers days, all of this, 91 through 50. It'll cover the skilled nursing. It'll cover the skilled nursing, and it covers all of your 20%. So this is the Medicare supplement. Now, there are enrollment periods for Medicare supplements. Okay, the open enrollment period starts when you enroll in Medicare Part B. So if you turn 65 and you're drawing your benefits, you'll automatically be enrolled. This is when you can get a supplement. If you, your question, if you wanted to work later and you still have coverage, your open enrollment period would be when you retire and you no longer have employer coverage and you enroll yourself in Medicare Part B. Whatever date that is your open enrollment period. So let's say if you decided, if your birthday is January and you retired in June, and you enrolled in Medicare with a June start date, that would be the date for your open enrollment because you waited until later. Does that make sense? Okay. Okay, so they're bringing out the food. Awesome. Okay, one thing to consider. With a Medicare supplement, during the open enrollment period, 3 months before your birthday, 3 months after your birth month, that's your open enrollment. Medicare supplements, the only time they are guaranteed is your very first enrollment. Every other time of the year, if you choose Medicare Advantage first and you decide I would like to get a supplement, those you have to apply for and go through medical underwriting. They will check your medical records. And they can deny you a Medicare supplement. The only time ever they are guaranteed is your very first Medicare enrollment. So if you are sickly or have major health issues, I strongly recommend really digging into the Medicare supplements because they are a guaranteed issue. They cannot turn you down. On your 65th birthday, your very first enrollment, you could have active dialysis for kidneys. They can't turn you down. That is the only time they're guaranteed. Other than that, you'd have to pass the medical underwriting. But we'll get more into that in a minute. Okay. Okay, we are going to move on to Medicare Advantage now. And I will recap all this, I promise. Medicare Advantage, this is very different. Who here has had work coverage before? Okay, most everybody. When you have work coverage, you have a deductible you have to meet. You have a network of doctors you typically need to stay in. Most group plans, when you go to see a doctor, it's a copay-based system. You have to pay your little copay and whatnot. Medicare Advantage functions a lot like that, a lot. With Medicare Advantage, it is going to help you cover the copayments and coinsurance. It's going to cover those yearly deductibles that we talked about earlier and help you cover some out-of-pocket costs. And they do use a network of doctors for Medicare Advantage. So Medicare Advantage combines two services in one. Medicare Part C is Medicare Advantage. Most Medicare Advantage plans come with a drug plan built in. Most of them do. Most of these plans also come with additional benefits included, like most of them come with dental. They come with vision benefits. They'll come with hearing benefits. So the Medicare Advantage is a bundled package, and it's more tailored for bang for your dollar. Okay, you get a lot with Medicare Advantage. Now, raise your hand if you've heard horror stories of Medicare Advantage. I have. Okay, They have. So, the number one problem with Medicare Advantage, the number one complaint is the network of doctors and prior authorizations. Medicare Advantage, they use prior authorizations. If your doctor orders a test, they want to make sure that test is medically necessary. For example, if you have a doctor that wants to schedule you an MRI because you have a headache, they will not approve that MRI until he has done a couple other tests first. So the doctor, that holds the doctors accountable for ordering excessive tests. That's pretty much why. But they do prior authorizations. They also have a network of doctors. That is why it's critical when choosing a Medicare Advantage plan, think of all the doctors that are important to you and tell your agent. When we work with a client, we will get a complete and thorough list of your doctors. We will get a complete and thorough list of all of your medications. We will put that all into our software. It'll take away all the plans that your doctors do not accept. It will show us exactly how much medications will cost. When Medicare Advantage is set up properly, it can be a very, very valuable tool for your health care. I have my own father on Medicare Advantage. Dad's 79. He's been on Medicare Advantage since he was 65. Now, his was set up properly. All of his doctors are in network, his medications, all of that. And he loves it. Now, just because that is the best plan for my father, to him personally, the word best is subjective. There is no best, okay? The plan I put my father on might meet his needs the most adequately. It might be the worst thing for you. You just never know. That's why it's really important to work with somebody. But the Medicare Advantage does come with quite a bit. I'm going to pause right now to let everyone go ahead and dig in. That way you can talk to your server if you need any sauces or whatnot, and I'm going to resume in just about 5 minutes. Continue just to be respectful of your time. So we're going to talk about some important dates right now. Important dates, it's going to be October 15th through December 7th. That is what we affectionately call AEP, or the annual enrollment period. One great thing about Medicare Advantage. With Medicare Advantage, they allow you to shop your plan one time a year. So if you get on a plan, because as you age, you are going to add some doctors to your healthcare routine. You might add some new medications as you age. So they give you the ability to shop your plan and change it once a year. So between October 15th and December 7th is the annual enrollment period. We can make a change for you. So you can change your drug plan or your Medicare Advantage plan. And that will start January 1st. So once a year during annual enrollment, that's when we like to talk to our clients, double check, are any new medicines? Let's put those in the formulary and check your costs, any new doctors, et cetera, et cetera. Then after that, January 1st through March 31st is the annual disenrollment period if you choose to return to original Medicare. So there's a window for that as well. Now, remember how we were talking about Medicare Supplement and Medicare Advantages? I love this slide. This is a very easy to understand slide, okay? Medicare Supplements. Do they carry a monthly premium? Yes, the monthly premium is going to be higher. I can't exactly quote, it depends on the company, but in our neck of the woods, it's going to be somewhere, depending on what plan you select, somewhere between 75 to 150, somewhere around there just for the medical. Now, Medicare Advantage, monthly premium, low. Most of the plans in our area start at $0, okay? That you can add to supplement your traditional Medicare. So very low monthly premiums on Medicare Advantage. Medicare Supplements includes Part D and dental and vision. Remember, Part D stands for drugs. No, Medicare Supplements do not come with a drug plan. You need to purchase one separately. If you require dental insurance, vision, or hearing, those are separate policies that you have to add in combination with the Medicare Supplement. On Medicare Advantage plan, it says sometimes we need to change that to most times. Most times it is going to include drugs, dental, and vision. Most of the time. There are plans that don't. On Medicare Supplement, co-payments to providers. No, you do not pay co-payments unless you select that one plan I talked to you about. On Medicare Advantage, yes, you do pay co-payments. Up to $7,500 out-of-pocket costs. On a Medicare supplement, no. Remember, on a supplement, you only have your Part B deductible of $257. After that, it covers everything. On a Medicare Advantage plan, since it is a $0 monthly premium on most of these, they give you a maximum out-of-pocket. Once you reach your maximum, the plan covers 100% of everything else. Now, the maximum out-of-pockets vary depending on plans, so I'm not going to get too much into that. In our area, $7,500 is a pretty typical higher one. Okay. Network of doctors. Medicare supplements, no networks. If you have a Medicare supplement, you can go to any doctor in the nation if they accept Medicare. Okay? If they take Medicare, you're in, which is about 98% of doctors. So no networks on Medicare supplements. Medicare Advantage does have a network of doctors. Okay, can I appeal coverage decisions to Medicare? Yes, on both. If your plan comes back and says, no, this is not covered, there is an appeal process that you can do, and it is highly effective. Can my plan drop my doctor? If you're on a Medicare supplement plan, the doctor is not legally allowed to say, we no longer take supplements. Okay, he'd have to get out of the entire Medicare program in order to do that. Your doctor cannot drop a supplement. However, on an Advantage plan, yes, your doctor can make the decision, I no longer want to take United Healthcare. Anybody hear the news of United Healthcare in Tupelo? They left North Mississippi Medical Center. So basically, United Healthcare and North Mississippi Medical Center, during their negotiations, as far as the money and all that stuff, they did not come to an agreement. North Mississippi decided not to accept United Healthcare. Okay. That's no worries, because anytime a doctor drops your plan, we can get you a new one. That's going to be a special enrollment period. Okay. So we worked with all of our clients that had United Healthcare, found the most adequate solution and moved them over, and they had no loss. They had no loss of coverage. Okay. So don't let that scare you, but it can happen. A doctor can drop a Medicare Advantage plan. Can my plan be canceled? Medicare supplements can never be canceled. However, Medicare Advantage can. And this really affects the really small counties. If it's an underperforming plan, they might make a change. It happens. It is few and far between, but it can happen. So it's important to know. Ability to travel the country and use any doctor and hospital. Yes, on Medicare supplements. No on Medicare Advantage because of the network of doctors. Now, the one caveat, as you retire, travel is amazing, right? If you're traveling on Medicare Advantage and you have an emergency, federal law states all hospitals in the nation have to accept your Medicare Advantage plan for emergencies. So if you fell and break your leg or was in a car accident, you have coverage at the hospital. That stops at hospital though. Okay. You would need to find a doctor that is in the plan if you just had a sinus infection or something like that, but it always covers you for emergencies. Okay, so choosing what's right for you. Let's talk about Part D. Part D is an optional prescription drug benefit program. When you get on traditional Medicare, you can keep traditional Medicare A and B, but it doesn't cover your drugs. You need a Part D plan to cover drugs. It is not required of you to enroll in a Part D plan. However, once you're on Medicare, if you opt not to take drug coverage, that is A-okay. At some point in your life, you will more than likely need drug coverage. And when you do sign up for a drug plan later in life, you will receive a penalty from Medicare. It's a formula they use. It's the number of months you went without proper drug coverage times whatever formula it is. And that penalty is a monthly penalty that lasts for life. It never goes away. So what we recommend when you get on Medicare, let's say we have dozens of clients that are taking 0 medicines. 0. If that's you and you're not taking any medicines, get the lowest price drug plan you can find to prevent the penalty later. And then when you are put on medicines, we'll find you the one that covers those the best. But you do want to have a drug plan because that penalty sticks around for life. Now, the largest penalty I've personally seen was someone that went 137 months without drug coverage. Okay, that's over 10 years. 137 months. Their penalty was $97 a month. So the penalties change, but just know the penalty stays for life. So, okay. You usually choose Part D in one of two ways, either a standalone insurance plan or a Medicare Advantage plan with the drug coverage. If you choose Medicare Advantage and the ones that come with the drug coverage that I was talking about, you'll never get a penalty because that is credible drug coverage. If you choose a Medicare supplement plan, you would, in order to prevent the penalty, you would need to get a Part D plan to go with it. And we can walk you through all that. There's tons of options with drug plans, and they can range as low as $24 a month, as high as $150, and there's dozens of them. So really, that's when you work with a personal agent to see what would be the best for you. Okay, Part D prescription coverage. Drug plans, they do come with a deductible. Now, plans vary. The deductible ranges from $0 all the way up to $590. The one good thing about Part D is 90% of these plans, if you are taking a generic medicine, your deductible does not apply to generics. It is only the branded or the higher tiered medicines when the deductible really matters. So just life advice, anytime you get prescribed medicine, always ask for generic. We all know this, but it's a big deal on Medicare. From $590 to $2,000, you are responsible for a copayment depending on the tier. So if you have a deductible, let's say if you're on Eliquis, which is a very expensive medication. If you're on Eliquis, you will be responsible for the deductible. That's $590. Then you will have a cost share depending on which plan you pay. So when you go to the pharmacy, you'll have some kind of payment that you owe when you pick up your medicine. On Medicare, whether you have a Medicare supplement with a standalone plan or a Medicare Advantage plan, either one, in 2025, there is a $2,000 maximum out of pocket on all drugs. So no matter, you will never spend more than $2,000 on your prescription medication. This is the very first year they did that. That's thanks to the Inflation Reduction Act that went through. When they passed the Inflation Reduction Act, there was a piece on Medicare. Prior to this, has anybody heard of the donut hole? You have? Has it ever applied to you? It hurts, doesn't it? Before Congress fixed this, they had something called the donut hole, and that it was called catastrophic coverage. If you hit $8,000 in drugs, your coverage would go down to almost zero until you hit 10, and then it would cover you. It was a big mess. I mean, it was crazy. But they fixed it now, capped everybody at $2,000. That's why there's deductibles on these plans. But that's a beautiful thing, because now you know, when you're on Medicare, if you were prescribed one of these violently expensive medications, once you hit $2,000, the drug plan is going to cover it, as long as it's on the drug plan. Okay. Other helpful resources, Medicare.gov is a very good website, surprisingly. It's got some good information on there. There's something called Choosing a Medigap Policy, Guide to Health Insurance for People with Medicare. That's printed by the CMS. That stands for Center for Medicare and Medicaid Services. That is the governing entity of everything Medicare. Okay. Okay, what else should you consider? Medicare drug coverage, we talked about the $2,000 maximum out of pocket. It resets every year. Okay, so one thing to consider, if you're on higher priced medications, you do want to consider your maximum out of pocket. Medications that are non-formulary will not be covered. What does that mean? The formulary. All of these drug plans have a humongous list of medicines they cover. As long as the medicine you're on is on that list, the $2,000 applies to you. If that medicine is not on that list, you do not have drug coverage on that medicine. Yes, you can. Yes, you can. And it is possible. It is possible. It's a process, as you know.
It's called VA.
Prior authorizations. And it's just not a guarantee, right? It's 90% sure you can get it. But not all PAs are 100% guaranteed. So that's why it's important When you meet with an agent, that's why we ask you all these questions. I want to know all the medications. Even if you're not currently taking it, if you filled it this year, you might need it next year. Let's go ahead and put it because we want to make sure everything you take is on the formulary. Also with the doctors. That's why we're so thorough with doctors. Okay. What about the specialist that you saw 4 years ago that you kind of forgot? What if he's not a network? That's why we really try to work with our clients and, stimulate your memory as far as doctors, because we want you to have a very good time on Medicare. And that's part of setting it up properly, like I talked about. So, another thing to consider. Most cancer and some heart medications will make you hit that maximum out of pocket. Okay, some of these oral cancer medications are so violently expensive, chances are you will hit your maximum out of pocket on month 2 or 3 if you are diagnosed with one of those. Now, there are plenty of things that we also sell to help cover up those, like a cancer policy or heart attack and stroke plans. Compared to the cost of these medications, these cost pennies. Like, seriously, we'll talk about it. Everything we bring up to you has value and is designed to save you money in the long run. Because with Medicare, this is a long-term thing. Okay, you're going to be on Medicare for a very long time. Things change. And it is our job to make sure that you are not going to have your retirement detonated because of one single cancer diagnosis. Additionally, dental, vision, and hearing plans. If it sounds like Medicare supplements are up your alley, we do need to look at a dental plan so you can have proper coverage for eyeglasses. Long-term care and home health care. Big misconception. Medicare does not cover long-term care. Nursing homes. Okay. Nursing homes are private pay. Medicare covers skilled nursing facilities. But as far as a live-in nursing home, that's where Medicare stops. They do not cover long-term care. So kind of keep that in the back of your head. Life insurance policies, we also do those at Bobby Brock. We do final expense. We do retirement planning. We do annuities. We do 401k rollovers. So if you have a 401k that you need to roll over, we try to be a one-stop shop. And at Bobby Brock, we have experts in each field. I am not the annuity guy. I'm the Medicare guy. Mike Penley is our annuity person. That's all he does all day, every day. He's an expert on annuities. So we can be a one-stop shop so you can just get everything done if you would choose to. So why choose us? We are independent agents. We're a broker. We do not work for these insurance carriers. Okay. We represent all carriers. We are licensed in all 50 states with every single carrier. And we do not work for a single one. If you get someone on the phone that is from United Healthcare, they are only going to sell you United Healthcare plans. Or someone that works with Aetna is only going to talk about Aetna. There could be 5 other plans that could benefit your situation. They're not going to bring them up because they're only going to sell who they work for. With us, we work for you. A broker, we have access to all the plans, and that's what we do. It's all individualized. We hold no bias to any insurance company. We're biased to our clients, saving you the most money possible. We shop all and every Medicare prescription plans that are available in the States before we make recommendations. And we do not charge fees for our service at all. At Bobby Brock, you get lifetime billings and claim services free of charge. What does that mean? Let's say if you decided that Aetna was the plan you wanted to enroll, and you get a bill from Aetna that doesn't make any sense. Something should have been covered, but it's not. Anybody tried to call an insurance company lately? They'll be on the phone for about an hour. Press 1 for English. You might be rerouted to somebody that has a thick accent that's a little hard to understand. Gets a little frustrating, especially when you're already getting bills. At Bobby Brock, if we write the policy, they will talk to us on your behalf. Let's say if I'm your agent, you say, hey, John, I got this bill. I'll say, hey, email it to me over real quick. I'll take care of it. I have a servicing team that will battle that carrier for you. It took you a 30-second phone call and 1 email, and you're done, and we will handle it for you. That's everybody's favorite part about Bobby Brock. And you also get the most experienced agents so far. This is an older slide. We're up to 50,000 now. We've helped 50,000 people so far. And we are what we consider the best in the industry. We're very proud of it. So I have a little bias towards Bobby Brock. Okay, so any questions so far? Not a single person? This is awesome.
Just back it all the way up from the beginning again. Medicare AB, the Medicare Advantage and Supplement are in addition to the Medicare AB and the drug plan.
Yes.
So you either choose the supplement or you choose Medicare.
Advantage, yes. So I'm going to break down even more simply. So here's a quick and easy way. If you are a convenience-minded person, you just want to go to the doctor, go to any doctor you want no hassles, they're going to get you in, you're willing to pay a higher monthly premium and receive very few bills, Medicare Supplement might be up your alley. If you are a budget-minded, I want the biggest bang for the dollar, I'm value-driven, and you're okay with some networks, Medicare Advantage might be up your alley. Because with Advantage, you don't have to purchase a dental plan, a drug plan, and a vision plan. It all comes together. With a Medicare Supplement, you have the ultimate freedom to go anywhere you want. If your doctor orders you a test, they're doing it. No questions asked. It's just super convenient. But it has a higher monthly cost. With a Medicare Supplement, you can't stop at the supplement. You have to get a package in order to have proper coverage. You can stop at the supplement. I wouldn't recommend it. But you need to add, so you got the cost of the supplement and the cost of the drug plan. Now, if you need dental, that's a third policy. And even with the supplement, there's still blazing holes. So I would add a cancer policy. For someone 65, it's $26. That's it. For a $10,000 check if you ever get cancer. That covers up all the holes. So with all that, that is the Cadillac of Medicare. That is the most thorough, comprehensive coverage you can get. For someone that, I'm going to throw out a number. Don't hold me to this. It's just spitballing. It's probably about $230 a month. $230 to $250 all in. What that buys you? A $257 deductible. After that, your insurance covers everything. No bills. If you have an open heart surgery, just keep paying your monthly premiums. Your deductible is $257. No more bills. On the flip side, let's say the $250, that's just too much. Man, I'm fixed income here. I can't afford that. Okay, let's look at Medicare Advantage and set it up properly because it costs you $0. You get your dental, vision, and hearing. And there is a supplemental policy we like to pair with them to cover the super expensive stuff. The $2,000 maximum out of pocket. That policy is $26. That will cover you from all of that stuff. And there's also a third policy we can do to cover your hospital co-insurance. There is a way to make Medicare Advantage a lot less expensive when you use it for a very nominal fee. And that is why we encourage you to make an appointment so we can show you everything. Because when we work with you, we'll put it on the screen. You'll ask questions. We will give you as thorough as we possibly can. And at the end of the presentation, you just say, you know what? I think this is what I would like. And you just pick from the menu. Does that make sense? But it's our job to make sure that you know. For example, I got my father a hospital indemnity plan. Okay. On Medicare Advantage, one of the expensive parts is your daily hospital copays. My dad's plan was $280 a day. If he was hospitalized, his plan would charge him a copay of $280 a day just for the first 7 days. After that, it covers everything. My dad is old school. Dad is the old school man that no matter what happens to him, his answer is pop an aspirin, I'm not going to the doctor. That's Dad. Okay, period. Well, he popped lots of aspirins and he was not getting better. Turned out Dad had pneumonia. Dad was admitted to Baptist in New Albany, and he spent 6 days in the ER because his pneumonia almost turned septic. He needed IV antibiotics. He got really sick. And then he got diverticulitis. He's all better now. He's out. With his Medicare Advantage, that 6-day stay in the hospital was going to cost him $1,800. However, this plan that I sold him, the hospital indemnity, covered all of that. His plan was set up, I think it was $39 a month. They wrote him a check for $1,800. And with that money, that's what he paid the hospital bill off with. So initially, his hospital stay cost him $0 because he got this additional policy. This is the stuff we want to bring to light. I cannot tell you how many people I've talked to that did not know these products exist that had a very bad time. It would have been like, that would have been nice to know 5 years ago. Says, now I got these humongous bills. You're telling me there's a product I could have covered. We're going to tell you everything. We're not going to pressure you. We're not going to say, you guys need this. It's going to be, look, here's everything that we can do, and then you can just pick it a la carte. Does that make sense? But it's really important that you get the information because these are big life decisions, and the cost of healthcare is crazy. So we want to work with you to help you make really good educated decisions, right? And that's the secret sauce, is the one-on-one attention you'll get, us working with you, presenting these to you without being pushy, saying, this is what you need, get this. No, it's like, here's the information, what was good to you. Any other questions? Nothing? Yes.
Comes to an appeal. Do you all do that, or somebody you gotta do it? I have to do it myself, or how do you?
We can help you with the process, but with an appeal, we will be involved, but you have to be involved a little bit, but we can guide you through it. So that's the best part. Like, it's not like, how do I do this? Well, just Google it. No, we'll walk you through the stuff if there's an appeal meeting. Yeah. They will let us service if we write the policy, because legally, I'm a licensed agent in all 50 states. You have a policy now, I'm assuming, some kind of policy. I did not write that policy. So if I try to call your company and say I'm your agent and they have no record of me, they're not going to tell me nothing.
Well, it's that. I mean, if you were my agent.
Oh, yeah. Yes. Yeah. If we write the policy, we can do all kinds of things with these carriers. It's really cool. Another thing about the Medicare Advantage. Medicare Advantage, a lot of these come with additional benefits. Does anybody have Medicaid? Anybody in here? Medicaid opens the door for something called dual plans. Okay, awesome. It's
What?
Oh, that's a good plan. What?
Y'all put me on it.
Hey, that's awesome. So we had a client that actually, they got a Purina dog food benefit from their Medicare Advantage plan. Some of these give you food cards. Some of them give all kinds of little benefits. There's a lot of additional benefits, and the secret's in the summary of benefits. There's a lot of hidden stuff in there. So it's really good. That's why an appointment with us usually takes 30, 40 minutes. We go through everything, leave no stone unturned. So at the very end of the appointment, you've seen everything that is offered in the zip code. Medicare is designed by servicing areas, and it's all based on zip code. So in 38801 and 38804, Lee County, that's a pretty big county, Mississippi, we have a ton of options. In something like Columbus, smaller county, they do have several options, just not as many. And so it all goes by zip code. Another thing I didn't cover. Let's say you move. Okay. 65, you're in Lee County. We got you on, let's say you selected Patriots. You're on Patriots, but now you decided, you know what? I'm tired of the heat here. I want to move up north. No one does that. Okay. We're going to move to Florida. It's up north. Never mind. So we're going to move to Florida. If you move, it doesn't matter what time of the year, because you are moving and changing your zip code, you will need a new plan for that area. Call me up. I will search that area for you. I will search the hospitals. Okay. Do you have any doctors? We'll find you the most adequate plan for you for that area, and it'll start the next month. So just know there are so many great things with Medicare. If you need to move, we can swap the plan over. No problem. There's a lot of good stuff. Any other questions, guys? Okay, well, think about it. Finish your food, and then all of us are going to work the room. So if y'all have any questions, just stop one of us. We'll be happy. My goal is to make sure that when you leave, you have no questions. All questions are answered. All of our cards are on the table here. Please grab one. If you think of any questions, feel free to give us a call. Our goal is to make sure all of your questions get answered.